anyone interested in drug policy reform ought to be concerned about levels of use. But we have to start off from the position of recognising that there are already 240 million people who use illegal drugs worldwide, and that the patterns of use change over a period of time. People switch from one drug to another, and that will also happen under a system of legal control and regulation. There is plenty of evidence to show that levels of enforcement do not determine levels of use. So harsh enforcement does not automatically result in lower levels of use. There's plenty of evidence over a period of decades, good science, to show that prohibition is not an effective deterrent, either to use or to availability. Supply just moves around depending on how the prohibition is enforced. We also have plenty of evidence from the decriminalisation of drugs in Portugal in 2001 that levels of use in Portugal only rose comparable to neighbouring European countries. The same happened in the Netherlands with their coffee shop system for cannabis. Levels of use increased, but only at the same level as comparable European countries. So again, we have real good evidence to show that changes to policy do not result in significant increases in use. The other one is tobacco use, which has declined consistently over the last 30 years. And the levels of harm consequently have reduced. And that's in a legal system where, to be honest, that there has been significant pressures from the industry to maintain its market and has effectively competed with government. But despite that, levels of use have continued to decline. The last point to make really is that levels of use is a very crude indicator of whether your policy is actually working. What we should be looking at is levels of harm. Levels of social harm, levels of health harm. Those are both very, very high under prohibition. And we know that the reductions that we could achieve in levels of social harm and health harms in a post-prohibition world where drugs are legally regulated, that those reductions in harm are so vast that even if use were to increase a bit, that the levels of harm would be significantly reduced in overall.